So today we'll be going through your discharge instruction packet in preparation for your upcoming surgery with your knee replacement. This works both for full replacements, partial replacements, and also revision surgeries. I will be going through the entire packet with you today. I will also be sending in prescriptions for you, and we will discuss the postoperative physical therapy protocols, as well as a lot of the common do's and don'ts and issues and bumps in the road that people encounter after surgery. So in this packet, this does have everything in it. This is functionally the Bible to follow for the next couple of months. The first page is making sure that we have done everything in preparation for surgery. The first one is that you should have seen your primary care physician as well as any other specialist, such as a cardiologist or pulmonologist, in preparation for the surgery. We will need the notes from them saying that you are in prime condition to go forward with the surgery. You should have already had your blood work done, which I will have reviewed. Part of that is the nasal swab, which will tell me what kind of bacteria normally grows on your body. And there I'm looking for anything that could possibly be resistant. So that way during surgery, when I give you your antibiotics in the operating room, I give you the proper type to match whatever grows on you. We're going to be going through your own medications and determining when to stop certain types of medications and when it is safe to restart them. There are some blanket categories that we need to stop a week before surgery. All vitamins, minerals, natural supplements need to be stopped a week before surgery. Also, all anti-inflammatory medications such as Advil, Aleve, ibuprofen, naproxen needs to be stopped a week before surgery. If you take a baby aspirin, an 81 milligram aspirin, that is safe to keep taking the entire time. If you take Celebrex, that is still safe to take before surgery because that does not impact any risk of bleeding, at least for my type of surgery. The next page in the packet discusses the bandage. This is very simple. It stays on for 2 weeks. Nobody touches it but me. That does help to prevent infection. It is gummy and flexible, and so will bend and move with you as you do your therapy. It is not waterproof though, so you do need to wrap it with plastic wrap, saran wrap, or a garbage bag in order to protect it when you take a shower. It is very unlikely that you would ever get any kind of drainage onto the bandage. As long as it does not get thoroughly saturated, it will be safe and will still function well to protect your incision and your skin. The next page starts to discuss medications that I'm going to prescribe for you today. The first one is the blood thinner. This is there to make sure that you do not get a blood clot after surgery, which could go to your heart or to your lungs. You will take this blood thinner every day for a month after surgery. You will start up the evening after you get home. Depending on what it is, determines whether you have to take it every 12 hours or every 24 hours. This will be determined based on your insurance, as to what gets approved, and also what variety will best suit your medical conditions. The next talks about pain management, and this goes in multiple steps. The first step is quite simple: icing, elevating, stretching the knee, and also taking Tylenol periodically throughout the day can help out with a lot of the pain. You can take up to 3,000 milligrams in a 24-hour time frame. Now, the next step up in pain management is anti-inflammatory medications. We have several options here. I will send in prescriptions for these. You will take them twice a day. You take the prescription until it's gone. It will be circled in your handout which one you should be taking. Now, the next step is a muscle relaxer. Not everybody needs this, but some people do get either spasms or really tight muscles after surgery. I commonly use one to help out with people with therapy because stretching is the #1 thing to be working on following your knee replacement. Also, a lot of people do get a lot of muscle pain, either in their calf or in their hamstrings, behind their thigh, as they work on stretching. If that becomes significant, you can take one of the muscle relaxants that can help out. Now that does bring up the final step, which is the narcotic. Typically I give Vicodin. Most people need, on average, about 10 or 12 tablets of Vicodin in their postoperative phase. I will give you slightly more than this in order to make sure that you have enough. If you do have any extra left over, I recommend disposing of them at the police station in the medication drop box that they have. Narcotics, we know, are bad for you. They cause constipation, they will make you sick to your stomach, they mess with your head, they're addictive, As it turns out, they also reduce your immune function and can increase your risk of infection and also increase the risk of scar tissue formation. So for the most part, you want to minimize these as much as you can. Breaking the tablets in half and spreading it out that way can help out. To help out with some of the side effects of the narcotics, I will give you a prescription for an anti-nausea medication, Zofran, which is a dissolving pill you put under your tongue as needed if you do get sick to your stomach. The other one is for constipation. A stool softener is very important to be taking, and very likely you will need some actual laxatives to push things through to help prevent the constipation or to manage it when it does happen. It is universal. Almost everybody gets constipated, so I recommend that you stay on top of things. The last thing that you want to be is a week out from surgery and no bowel movement. That's when you have to go to the emergency department, and nobody wants that. The next few pages start to talk about physical therapy, and this is your number one job after a knee replacement. You need to be doing a minimum of 3 hours of stretching every day on your own, broken up throughout the day. I recommend 15 or 20 minutes every hour during daylight hours. The most important one early on is keeping the leg elevated with something underneath the heel. That way, gravity can just help you straighten out the knee flat. But you can also push on it and have other people assist you with that to help push it all the way straight. To work on bending, you can do that also laying down by lassoing something around your foot and sliding your heel up toward your butt. Or you can get into a chair and slowly pull the foot underneath you in a seated position. Both of these are very simple stretching exercises that can be done early on. As you progress, the therapist will also help in different areas, picking out other exercises for you to work on. But the key is you must be doing them a minimum of 3 hours a day, every day. The home therapist will be working with you for the first 2 weeks. They typically work with you about 4 or 5 days a week and start up the same day of surgery. They will help to get you in the house and tucked in, make sure that you are safe. The next day when they come back, that's when the real torture starts up. And it is difficult, I know this, it hurts a lot. This is why you take the medications to help out, but as long as you do it and you actually are getting that motion back in your knee, your pain will go down much faster. Patients that I have in the office 2 weeks after surgery, when we get the bandage off, I can always tell who's been doing the therapy. The people that don't have any pain have done a large amount of therapy and they've gotten the motion in the knee. It doesn't hurt them. The people that have not done the therapy, they are still in a lot of pain, and it's because it's so stiff and it's not moving or working for them. So it is very important to be doing the therapy. I also have several pages here for the caregivers that goes through what's normal as well as what to expect. Low-grade temperatures are quite common. If you develop a fever over 100.7 or 101 degrees Fahrenheit, then that is when you should call us. Anything under that is very common and normal after a major surgery. You will have a tremendous amount of swelling in your leg. The more that you ice, the more that you elevate, the more that you do your ankle pumps and your stretching exercises will help to reduce that. But your leg does become a tree trunk for that first week after surgery, and only then does it start going down as long as you've been doing these instructions. Eventually, it will just stop happening and you won't have any more swelling. The other thing that happens to everybody is bruising. Up and down the leg, very common. Some people get a tremendous amount of bruising, and that's okay. That is normal. Other common issues, dehydration. And what that leads to is dizziness when you sit up, or if it gets really bad, you can pass out. When people pass out, it can be quite frightening for people that are witnessing it. This does happen when you get dehydrated, or if you've taken too much of the narcotic, or if you've just pushed yourself too much and spent too much time upright right after surgery. So it is very important to go slow, take it easy in the beginning, and be wary of the narcotics and drink lots of fluids. There are other common issues that are encountered here. I do have them all detailed. Also, my cell phone is in here. I ask people that if they need to reach me, they can send a text. Daylight hours preferable, just so that way you're not waking up my entire household in the middle of the night. Also, we have the emergency line is available 24/7. All you have to do is call the office line and they will get through to you. What I tell everybody about this surgery is that this is like a roller coaster. When you are walking around the amusement park, You'll look at people getting on the roller coaster, they're screaming, laughing, having a great time. You say, oh, that looks nice. That looks like they really had a great time with that, because everybody's smiling when they get off of it. If you get on the line, then the anxiety starts to pick up, the heart rate starts to get going. The closer you get to getting on the ride, the more things are going up. You get really anxious right as you're getting on it. That's exactly what it's like as we're approaching that day for surgery. The anxiety goes up, the heart rate goes up, the blood pressure goes up, all normal. You get through the ride, and then at the end of it, you're like, oh, that was great. I'm glad I did it, but it takes a long time. It takes 3 or 4 months to fully recover from the surgery. Oddly enough, if we have to do another surgery on you, it starts all over again. You get back in that line, you are just as anxious a second time around, even though you know it will turn out well at the end of the day. So the anxiety is normal. And it is a rough trip, especially that first week after surgery. You do have a lot of pain, a lot of immobility. You have to do little steps, little bits every day, little bits every hour to get through this. And as long as you do that, slow and steady, you will end up doing really well. There will be good days, there will be bad days. That's normal. You just have to keep plugging away at it. I'm really looking forward to seeing you before surgery. We will get through this together. You will have a good outcome. It will take time, but you will be pleased with the results. In the meantime, you will be seeing Austin, my PA. He will be working with you. He will also be working with me on the day of surgery. After surgery, you will be seeing both of us at different points in time. I will next see you in the office 2 weeks after surgery, and we'll get the bandage off then.